Good morning. Our research project is titled On-Site Assessment and Management of Dental Injuries in Sports. Initiated in 2017, this educational project has passed IRB review and is on hold for implementation at this point in 2021 due to COVID-19 restrictions. Dental injuries in youth and adolescents, especially those participating in sports, are common. Typically, at this level of competition, team dentists and athletic trainers, as well as team physicians, are not present during games and practice sessions. The responsibility of on-site assessment and management of dental injuries falls under the jurisdiction of the coaches. While parents, spectators, and/or coaches may attempt to lend aid to a sports dental trauma injury, these individuals are often not dental professionals, nor have they the knowledge for appropriately managing these cases. Despite being responsible for the overall well-being and health of the players, these individuals typically do not have a dental background and are ill-prepared for on-site assessment and management of a dental injury whenever it occurs. The purpose of the study is to evaluate the knowledge of all athletic coaches and league support staff, as well as the parents of youth and adolescent athletes regarding their understanding of on-site assessment and management of dental injuries. An attempt was made to recruit athletic coaches and league support staff, as well as the parents of youth and adolescent athletes who are participating in recreational leagues within the Salt Lake Valley. Our research team specifically focused on the recruitment of parents whose children were specifically playing in the sports of boys rugby and Utah girls tackle football. The first step was the creation of an educational PowerPoint dental trauma presentation. The title of this educational PowerPoint presentation was What to Do If Your Child Injures or Knocks Out a Tooth. It was approximately 25 minutes in length. Topics covered in the presentation included tooth fractures, dislocated teeth, and the knocked out tooth. And who are you going to call? You can call your family dentist, an endodontist, a pediatric dentist, or go to your local hospital to see an endodontist. We also recommended that parents be prepared for any emergency by keeping milk or the Save a Tooth kit on hand during sporting events and knowing who to call in a dental emergency. We discussed the nature of the PDL and the need to preserve vital PDL tissue in order to have a more successful prognosis for reimplantation of a tooth in an attempt to minimize external root resorption or ankylosis of the tooth within the bone. The PowerPoint presentation was part of a program that was going to be presented to participants at Roseman College of Dental Medicine in the D1 classroom in the evenings between 6 and 7 p.m. This dental trauma educational program included this PowerPoint presentation as well as a series of questionnaires. The next step of this research project was the development of the survey instruments that included a demographic survey, a pre and post test, as well as a program evaluation. The goal of the survey was to determine background information of the parents whose children were playing sports, if the parents learned relevant information from our program, and if these parents enjoyed the course and would recommend this course to others. The demographic survey included 17 questions. Specifically, question topics addressed whether the parent was a mom or a dad, the age and ethnic background of the parent, the highest level of education achieved by the parent, the grade level of their child playing sports, and specifically, what sport their child was playing. A pre-test and post-test was created. It included 10 questions regarding dental and jawbone anatomy, assessment and management of fractured teeth, and assessment and on-site management of a knocked out tooth. The post-program evaluation survey was also 10 questions and covered various topics, which included did the program increase the parents' knowledge of an on-site assessment and management of dental injuries? Did the program allow parents to be more comfortable in on-site assessment and management of dental trauma? Would these parents recommend this program to other parents? Our research team encountered many obstacles in obtaining parent participation. There was a lack of interest from sports organizers. Brian Hatfield, class of 2020, was attempting to get information from youth rugby organizers to contact parents in November at the beginning of their season. By winter, Brian had not been allowed to attend any organized activities or meetings, nor did organizers make him aware of any dates of the events that were being held. We also had a lack of interest in sports organizers and parents of athletes participating in Utah girls tackle football. Amber Haskins, class of 2020, was in contact with one of the group organizers in charge of the recently established Girls Tackle Football League. Amber and Mariah were invited to attend the first sporting event. We had researched the main person in charge of organizing the event and were able to recognize her from her Facebook profile picture online. When we arrived at the event, we witnessed this person ignore several phone calls from us while chatting near the breakfast tent. Eventually, the person sent us a text inviting us to hand out flyers to the parents. We passed out flyers to the parents and did not receive any interest from these parents. Presently, there is a lack of interest in this research topic by the community. Activities involving sports dentistry research has been essentially shut down because it's not on anyone's mind. League organizers, as well as athletic directors, are primarily concerned with screening and keeping players on the playing field and staying safe from COVID-19. Regarding future considerations, Dr. Soph and his wife are soccer parents. To increase parent participation, the research team has decided to redesign our research protocol and program. We are in the process of creating an educational video on dental trauma that will be 10 to 12 minutes long. The video will contain 3 to 4 modules lasting 3 to 4 minutes each. There will be 2 to 3 questions following each module, and parents will be provided with a cell phone link to the video, and the data will be collected via Qualtrics. By incorporating these changes, the research team will move away from having an in-house dental trauma educational program to designing a program that parents can participate in within the convenience of their own home at a time of their choice. Rather than concentrating on one specific sport, our research team will now attempt to recruit parents of children participating in any sport, not a specific sport. Dr. Wisniewski envisions the creation of a large sports dentistry database. Utilizing this database, future research questions can be investigated. It is the PI's goal to provide Roseman College of Dental Medicine students the opportunity to conduct clinical research in sports dentistry. This unique clinical research activity might help students to enrich their resumes and help them in the pursuit of postgraduate programs. I want to thank you, the viewer, for listening to this presentation about our research project.